Joining me now with medical researcher and a virologist, Dr. Kolawole Oladipo. He joins via Zoom. Travel ban is one characteristic measure we see countries take to curtail the importation of viral diseases during a pandemic. Do you agree with the Information Minister that the UK's decision this time, particularly in the case of Nigeria, is punitive and discriminatory?
Well, thank you for having me on the news this evening. Honestly, I'm in full support of what the Minister for Information actually said. Banning Nigerian at this time is not the best step to take, though they could be doing that in the interest of their country, but there are other ways that these can be resolved.
We've seen some African countries take the same caution, particularly an example here will be Rwanda, ensuring that it shuts its door to countries in southern Africa. Nigeria also had the issue. Some would say that we were not as apt enough to shut down in the early days of the COVID-19 outbreak. How are we doing right now?
Now, you can see that the protocol has been reviewed, and it's now 48 hours instead of 72 hours. And we have some things that we have to do right. Let me digress a little bit. We have something we have to do right, and that is the ability to substantiate that this test can be verified easily. You know, like some other countries, at the airport, there is a database, you know, that we can quickly verify if this test is actually authentic. You know, one of the reasons that made UK to make such a decision was that because some of those people that were positive to the virus were having negative PCR tests. So if that can be done, and I know most of the East African countries that have been to during the COVID period, at the airport, there's a database that you can use to clarify, to check if the result you are having is actually authentic. So when those measures are in place, it's more easier to believe in our test and to take proper measures in combating this virus.
I understand your point of view. I'm just hoping that that is also relevant to Nigeria, particularly considering how the influx of people from places where this new variant has been largely discovered. But talk to us very quickly about how dangerous this new variant is.
Well, I can say now that from what we have seen so far and what we have read so far and from work that is ongoing, there is much yet to be known about this virus because the number of people infected are still very small and the data coming out is still very few. Scientists are working hardly on this virus in order to get more information. The basic truth about this virus now is that the mutations that it had, almost 2 mutations of the spike levels of this protein, make it more highly transmissible. It means it has a higher transmission rate than the Delta variant. So it means if not well curtailed, our health system may not be able to handle that. But still, we believe that much is yet to be known about this variant. And in a few couples of days or weeks now, all of us will have better understanding about this variant. But that doesn't mean that we should lower our guard. We should be very, very careful using our hand sanitizer. All those non-pharmaceutical measures should be put in place. Despite that we have relaxed. But this period is highly dangerous for all of us. So we should not relax and we should make sure that we are on the top of this game.
Medical researcher and virologist Dr. Kolawole Oladipo, thank you for talking to us tonight.
Thank you for having me on this platform.